Give me an account that's definitely off of here.
Dr. Michael Lange, Facebook.
Come on, man. This phone is just begging me to throw it against the wall. Is that one of them?
Dr. Michael Lange.
That's one of them?
Mm-hmm.
Okay, it shows you live.
Okay, turn the monitor down and hear the music. Be golden.
It's not picking it up.
Picking it up on there.
Well, we can do the first thing is this. See if it'll switch over. You might have to check this in the restream settings. Okay, check, see if restream will pick it up now. If I remember right, last time Julie used restream at the Trump event, she had to go in and change the sound setting of restream to take the sound off.
Chill House Mix. Chill House Mix.
Ask the Doctor with Michael Lange begins in 7 minutes. Ask the Doctor with Michael Lange begins in 5 minutes. Ask the Doctor with Michael Lange begins in 4 minutes. Ask the Doctor with Michael Lange begins in 3 minutes. Ask the Doctor with Michael Lange begins in 2 minutes. Ask the Doctor with Michael Lange begins in 60 seconds. Ask the Doctor with Michael Lange begins in 30 seconds. Ask the Doctor with Michael Lange begins in 10 seconds.
When it comes to your health, are you seeing the check engine light come on more than normal? It's time to get under the hood. It's time for Ask the Doctor with Dr. Michael Lange. Sponsored by Lange Eye Institute and Fortifeye Vitamins. Dr. Lange is a board-certified optometric physician and certified nutrition specialist, helping people see and feel better through proper nutrition for 25 years. The doctor is in. Call now with your questions at 877-969-8600. That's 877-969-8600. Here's your host, Dr. Michael Lange.
Okay, good morning and welcome to Ask the Doctor. I'm your host as usual, Dr. Michael P. Lange, P for Paul, here each and every Saturday morning live to answer any and all questions you may have regarding your vision and eye care. If you've got a question, don't be shy. Pick up the phones and give me a call. You can learn a lot more about what we have to offer. Either go to my personal website, that's simply drmichaellange.com, or go to our Fortifeye Nutrition website, and that's fortifeye.com, Fortifeye, fortifeye.com. That's a supplement company I started that's based on the right ingredients, right science, right for you. Let me give you the phone number for Fortifeye Vitamins Monday through Friday before we get started, because a lot of you are always on social media asking for that. So I'm going to give you the phone number. Write this down. Get a pen and paper. I'm going to give it to you twice. Fortifeye Vitamins, based out of Ocala, Florida, and Clearwater, Florida, is 866-503-9746. That's 866-503-9746. Also, I hail from the Lange Eye Institute in the Villages, Florida. So I do see patients Monday through Friday, sometimes Wednesday through Thursday, just depending on my mood, I guess. Dr. Lori Caputi is there also. And we have a brand new doctor, Dr. Chris. I'm not going to say his last name yet. I don't know if he told his current employer down in South Florida yet. But he's an ocular disease expert. He is starting the Lange Eye Institute on December 1st or 2nd. So he's got 20 years in the business, and he's an all-American kid. Well, he's not a kid. He's probably 48 years old. So we want to welcome Dr. Chris to the Lange Eye Institute staff. Holidays are approaching, so I want to take this opportunity to wish everybody a happy, healthy Halloween tonight. Don't overindulge with the candy, all right? Also, the Fortifeye Nutrition Center opens really kind of today. We don't really open until Monday, but we're going to do a soft open today after the show. So I'm going to be there after the show. Come on out to the Fortifeye Nutrition Center. I'll probably be there a couple hours. I'll get there about 10:30. Arlene will be there. Miss Nita will be there. We'll have some specials going on. Remember, the Fortifeye Nutrition Center is in Clearwater. If you're coming from Tampa, right across the causeway, turn right on McMullen Booth Road. Go down about a half mile on the left. It is called Bayside Plaza or Bay Bridge Plaza. That's where Publix is, and a couple of gyms and some pet stuff and all of that. You can't miss it. We're kind of in the middle. The sign isn't up yet, but we're next to like a tobacco shop, I think, or something like that. But you can't miss us. When you look inside, you'll see a nutrition center. So I'll be there at 10:30 today, and we'll be wheeling and dealing. So come on out and meet and greet myself, Arlene, and Miss Nita. Remember, this is just kind of a soft open today, and you will be able to buy your supplements. All right. You're listening to Ask the Doctor. We're going to talk about omega-3. We're going to talk about the most advanced multivitamin on the market today. We're going to talk about how, believe it or not, things like almonds and cashews and Brazil nuts and peanuts and walnuts and pumpkin seeds and sesame seeds and sunflower seeds are not high in omega-3. They're much higher in omega-6, which is pro-inflammatory. But there are a few nuts you can eat, like macadamia nuts, all right? Flax and chia is actually high in omega-3, but men don't need to be eating a lot of flax and chia. because they're very high in phytoestrogens. Now, you don't want your testosterone to drop, right? So think about it. You drink a little red wine and has some chia seeds, you're in big trouble if you're a man. Red wine is also very high in phytoestrogens. All right, we're getting ready to go to the phones, but first I just want to take this opportunity real quick to welcome my co-host, Doc Hall. Doc Hall, welcome to Ask the Doctor.
Good morning. It's good to be here with you this morning. Want to welcome all of our friends and listeners and wish everybody a happy and safe Halloween. And also, before we forget, because we'll go through the show so fast, remind everybody, fall back tonight with your time. And don't forget to set your clocks. And what I always forget is set my watches. I have the time in the house done and in the office, but I'm going down the road and I have a different time on my wrist, and it's panic ensues. So don't forget that tonight before you go to bed. And we get to sleep in a little bit tomorrow. We get an extra hour of sleep, so that's kind of nice for this fall. It's chilly, 50-some degrees here in Ocala, and so that's chilly for us in Florida, folks. I know my good friends Tim and Sheila up in Ohio. I talked to them this morning. It was down in the 30s. Now, I'm not about that, so I'll take the 55 or 60 degrees this morning. But anyway, good morning, everybody. Glad to be on the show with my good friend and colleague, Dr. Michael Lange.
Thank you, Doc. And I want to reach out and say hello to Teresa Rocha. Say hello here in Brazil. So we got people all over the world actually watching us on social media and all over the country listening to our voices right now. So I want to say hello to everybody in Nashville, Tennessee, one of my favorite towns, listening to WLIC, and certainly Gainesville, Florida, Ocala on 97.3 FM, and a lot of other radio stations. But we're going to Steve in Bradenton. Steve's been on hold patiently. Steve, good morning.
Good morning. How's the greatest tag team in the world doing today?
We're doing pretty good, my friend.
That's good. And that's ironic that your vitamin shop is next door to a tobacco shop.
Oh, yeah. We got to get those people healthy. You know, if you're smoking a lot, you got to have more antioxidants to protect. You know, it's hard to turn those people off from smoking, but we can actually protect against some of the deterioration that smoking does by taking specific supplements. Believe it or not, you do not want to take a supplement with beta carotene in it if you're a smoker. There's evidence that it increases your risk of lung cancer. So none of our supplements have beta carotene in it. Our Fortifeye Complete, which is the most advanced multivitamin really, I think, on the market, has no beta carotene or vitamin A. But it has everything else in it that you need: the vitamin D3, the vitamin C, the zinc, the quercetin, the bromelain, the methylated form of B complex, the curcumin, CoQ10, NAC, lutein, zeaxanthin. It has the 8 forms of vitamin E, plus a bioactive ORAC blend that increases your antioxidant protection that I developed. And that's called Fortifeye Complete Advanced Nutrition. Everything we talk about in this program about helping to support your immune system during these crazy times is in that little pill. You take 1 a day if you're less than 160 pounds, 2 a day if you're probably over 160 pounds, or if you're an extreme athlete, 2 a day. If you're a smoker, 2 a day. It can help combat against the deteriorating side effects potentially of smoking. It's called Fortifeye Complete at fortifeye.com. That was a great segue, Steve. Thanks.
You're welcome. You think of everything. You're the total package.
So what's going on in Sarasota? What? No, Bradenton. You live in Bradenton. What's going on over there? Is it chilly?
It's a nice morning, nice and cool. Yeah, it's pretty chilly out here with my shorts on. I said, whoa, it's a little cool. My question today is about when you lose your eyesight to the, when you got diabetes, what's that called?
Diabetic retinopathy.
Yeah. When you lose your eyesight to that, what happens to your eye when things become distorted and you just can't see as well? And is there any treatments for that they can do to help you out?
Well, diabetes is the leading cause of blindness, not vision impairment in this country. The leading cause of vision impairment is macular degeneration over 60. The leading cause of blindness is diabetes. And this is because the diabetes causes the tiny little blood vessels to develop what we call leaky microaneurysms, all right? These little blood vessels break down and they leak. When they leak, they bleed into your retina. They cause swelling, edema, especially in the macular region. So you develop diabetic maculopathy, or the technical term is clinically significant macular edema. When that happens, you can have visual devastation, luckily, we have lasers for this, all right? But we also have injectable medications now, anti-VEGF injections, anti-inflammatory injections, a lot of great injections. A lot of this is we do at the Lange Institute upstairs in the Lange Institute with Dr. Michael Tolatino. So the good news, it is treatable. It is not curable. But Steve, you know, the key here with being a diabetic is controlling your blood sugar. You want a fasting blood sugar as close to 100 as possible in the morning. You want your hemoglobin A1C, you know, really below 6. So it's all about diet, proper supplementation, exercise, weight management, hydration, sleep. All of that is crucial for diabetics. Also controlling your blood pressure. Think of being a diabetic as having the blood vessels in your eye like an old rotten garden hose in the backyard. And if you put a cork in the end of it and turn it on wide open, it's going to burst and it's going to leak all over the place. So think about lowering the pressure, lowering your blood pressure is going to decrease the chance of all this leakage from diabetes. So diabetics need to have blood pressure under amazing control, plus blood sugar under amazing control.
Yeah, the last few times I've gone in, he hasn't given me an injection. He says it didn't seem to be helping me, so he just hasn't been doing it. Does that make sense?
Right, right. So they look inside the eye with their 90 diopter condensing lens with digital photography, OCT technology, and they determine whether or not you need an injection. So, you know, that could be a good thing, all right? The least amount of shots in the eye, the best, I always say.
What's the odds of something happening to your retina when they give you a shot in the eye? It's a pretty low percentage, right?
It's very, very low. I mean, the Lange Institute upstairs, they do, and we used to do it downstairs, thousands and thousands of these injections, all complication-free. I should say mostly complication-free. Anytime you inject something in the eye, there's always the risk of an infection. That's called endophthalmitis. There's always the risk of a retinal detachment. But when you do any type of treatment in the eye, you always have to justify the risk being less than the benefits, or the benefits outweighing the risks. And that's what we do before we inject your eyes.
I guess that's just common sense, huh?
I guess so.
Does dehydration, can that affect your eyesight too?
Oh, absolutely. The majority of us are dehydrated, Steve. We're not drinking enough fluids, enough good water. So we need to drink more water, and Doc Hall knows that for sure, too. So we need to drink more water. Everybody should be drinking half their body weight in ounces of water, good water, spring water, or the Wata water that I promote a lot.
Okay. All righty. Well, thank you so much for your time today. I sure appreciate it. Thank you so much, and have a great Halloween.
All right, Steve. Happy Halloween to you too, my friend. Take care.
Steve, you take care.
All right, Bob. I think Bob is online too. Bob got beat by Steve this morning. Bob, thanks for holding, my friend.
Good morning, doctors. Pleasant morning up here in Ocala. Beautiful. I understand that you ended up getting some gator tail in the intake manifold of your Skidoo.
Yeah, we're out there jet skiing, or wave running, I should say, over 70 miles an hour on the water, which is, you know, almost as much of a rush as racing cars. But yeah, those are very, very finicky machines. If you go through the weeds, if you go through the lilies, it sucks things into your intake. But that's okay, because you can reach down underneath the jet ski and pull that out. But my race jet ski, something happened and it wouldn't run well. I mean, it was over revving, and I had to pull it out and put it on the trailer and look up in there, and there was a rope actually that was wrapped tight around the impeller. And so it wouldn't run basically well at all. And so Martin's Yamaha, Brad over at Martin's Yamaha, I got to do a shout out. They do a great job. Came over, picked it up, and fixed it, and bringing it back. So we'll be back in the water today.
Well, that's excellent. Well, you don't have any walls to run into, but be sure you wear your helmet and your life vest on.
Well, I definitely got the life vest on, but I'm thinking about wearing the helmet too. Let me tell you, if you hit the water at 70 miles an hour and you don't have a helmet on, you're in big trouble.
It's going to hurt. It's going to hurt.
Yeah, you potentially may die.
I have a quick question before I ask my question. Do you have a telephone number for the Clearwater Fortifeye office?
We do, but I don't know it. So what you would do is just call the toll-free number, and they would give it to you, or they will put you through. And the toll-free number for Fortifeye Vitamins is 866-503-9746. That's 866-503-9746. And certainly go to fortifeye.com. I'm going to try to have webmasters post some information on there and the phone number today or tomorrow, sometime very soon.
Okay, very good. Now, for my question, I inadvertently picked up a bottle of vitamin C, but it also had bioflavonoids in it.
Mm-hmm.
And my question is, I mean, I've heard that word before, but I have no idea what they are, what they do, and if there's any concerns about them.
Yeah, so bioflavonoids, especially citrus bioflavonoids, kind of work in harmony with vitamin C, and they make it work a little bit more effective. And what a bioflavonoid is actually when you peel an orange, all right, and you look at that white pulpy stuff that you peel off and usually throw away, that's the bioflavonoids, where all the quercetin, the hesperidin, all the citrus bioflavonoids are in there, and that's very good for you. So if you juice an orange, you always want to juice it with that white pulpy stuff. And eat that white pulpy stuff. It's also high in fiber, but it has all the citrus bioflavonoids, which helps the vitamin C absorb. So, yeah, that's good stuff. It's good stuff. We have that available at the new Lange Nutrition Center. We've got at the Lange Nutrition Center and the Fortifeye Nutrition Center in Clearwater, we've got about 5 or 6 different types of vitamin C, different types of vitamin D3. We got a lot of great stuff.
Okay. Any cautions about it? Would I give it to my wife?
No, not at the recommended dosage. At the recommended dosage, absolutely everything's fine. If you take too much vitamin C, then you're going to be in the bathroom because you're going to have the runs. You're also going to have an upset stomach. So if somebody's taking, a lot of people, they take mega dosages of vitamin C, 6,000 and 7,000 milligrams. And, that could also increase your risk of kidney stones, all right? And you don't want a kidney stone. But you always want to do it in divided dosages. I think 1,000 milligrams or less per sitting, you're going to be fine. Anything over 1,000 milligrams at one sitting, you're going to potentially have cramping and the runs.
Okay. Well, now I know you don't remember. You've got thousands of people you talk to, but she's also battling an underactive thyroid, and she's on a cholesterol medication. Any contraindications there?
No, not at all. The vitamin C would be good for the underactive thyroid. It's also good for cholesterol. Now, she needs to be on CoQ10 if she is on a statin drug because you get lower levels of your cholesterol. So CoQ10 is very important.
Okay, good. I'll see if I can't fix them up. Thank you, gentlemen. Enjoy your Halloween and get ready for Thanksgiving. Lots to be thankful for.
Amen, Bob. Thanks for the call, buddy.
Yes, sir.
Take care, Bob. Next week. Good to see you this week. Thank you.
All right, you're listening to Ask the Doctors. Doc Hall, PhD in clinical nutrition. He's a icon in the sports nutrition world, also a certified sports nutrition specialist. I'm Dr. Michael Lange, board-certified optometric physician and certified nutritional specialist. You get 2 doctors today, and any of your questions, certainly as for educational purposes only, does not replace a comprehensive eye evaluation. Doc Hall, let's talk a little bit about kind of an insurance policy. Taking certain vitamins can act as an insurance policy, hoping that nobody has nutritional deficiencies. Let's face it, most of our listeners aren't eating 13 servings of organically grown fruits and vegetables a day. So Steve had really done a segue for me to just promote and talk a little bit about a supplement we developed called Fortifeye Complete Advanced Nutrition. And when you listen to talk radio, you hear all sorts of people talking about magnesium and calcium or their special vitamin C or their green tea or their greens and fruits pop, and we hear about that. But Fortifeye Complete has really taken it all and put it into one USP certified tablet. Let's expand a little bit on that. Your thoughts, Doc Hall?
Well, I really like our multivitamin. The Complete, the name says it all. As I coined many, many years ago, and I'm sure others have too, but it's been one of my staples when I talk to folks, is our multivitamin is like an insurance policy. It's covering the bases. We all don't eat perfectly, as you said. We don't eat so many servings of fruit or vegetables that we should, or and we don't receive all the vitamins, minerals, and nutrients that we really need. And this is just a very simple preparation. I mean, it with the ingredients that are in here, it covers everything, as I would say, from A to zinc. And it has a lot of things in here that multivitamins that you get over the counter, they just don't have it, and you need it. And that's the problem. That's a good thing. Another thing is we don't overdo. As you spoke to Bob earlier about the vitamin C, I always recommend 1 gram or 1,000 milligrams or less. And if you're taking more, you have to do divided doses, obviously. We don't overdo any of the vitamins in here just to make it look good. B vitamins, you'll notice in some multivitamins are just overdone. There's 10,000% of something. It's like, are you kidding me? What does that do? Now, most people that I talk to say, well, doc, like with B vitamins and like that, if there's too much in there, your body just eliminates and stuff. And that's true. But here's the thing, your body still has to process that. It still has to go through the whole filtration system of the body and digestive system and like that. So there's still a process that goes on, and it's taxing your system. So we don't want to do that. Same thing with zinc. I sat with a lady the other day. She brought in all of her vitamins, and she actually had 2 bagfuls, to be quite honest. But she was taking zinc in from 8 different sources. She had a skin, nails, and hair formula, which was loaded with zinc. She had a multivitamin that was loaded with zinc. She had zinc standalone, 2 of those. And she was taking in seriously about 15 times the amount of zinc that she was supposed to do. We don't do that. Ours is very, very balanced, and that's what I like about it. And I hear raves about it all the time. I'm on it. Certainly your family's on it. My 93-year-old mom is on it. And it's very safe. It's a good multivitamin, but it goes beyond just the basic multivitamin. There's so much more added to it.
Yep. And what I want to talk about briefly is there's a certain formula I worked on for quite a few years, and it's called the Bioactive ORAC blend that is in Fortifeye Complete. We've taken goji berries, we've taken spinach, kale, blueberries, bilberries, pomegranate, mangosteen, green tea, grapeseed extract, curcumin, cinnamon, all of that into this Bioactive ORAC score. ORAC stands for oxygen radical absorbency capacity. That basically boosts the antioxidant power. And we put that into, as most manufacturers won't do it because it's very expensive. But that helps your antioxidant levels go up, helps protect you against oxidation. That's rusting in your body. And remember, we've also taken all the vitamin D3, the right form of vitamin C, the right form of zinc monomethithione with no copper, all right? Quercetin, which helps the zinc absorb. Bromelain that helps the quercetin work. So the methylated form of B12, one of the most bioavailable forms of curcumin. And also it's for the eye as well because it's got the lutein and the zeaxanthin, the resveratrol, the taurine. It's got so much in it in the right levels. Remember, we did a lot of intracellular blood analysis, a lot of DNA testing when we developed this. I've changed this formula 14 times over the last 16 years based on the research that we were involved in. So it's called Fortifeye Complete Advanced Nutrition. It's on the Fortifeye website at fortifeye.com and use show 25. We're getting close to the last week. We're going to run this special, show 25. As the promo code on the website, you're going to get 25% off. We're going to run that today also at the Fortifeye Nutrition Center when I get there at 10:30 today. So Fortifeye Complete Advanced Nutrition, one of the most advanced multivitamins, eye vitamins, veggie cap, fruit cap, enzyme. You take 1 a day if you're less than 160 pounds, 2 a day over 160 pounds, 2 a day if you're a smoker, 2 a day if you're really athletic. And it won't hurt you to take 2 a day if you're under 160 pounds. There's nothing in it that's going to be toxic, nothing at all. Like Doc Hall mentioned, we don't put super high levels of anything. There are a few things that have high levels, like the B12. Certain the B vitamins are high because of absorption properties and because of the studies on macular degeneration, proving that actually more in those specific nutrients is better. So check it out at fortifeye.com, Fortifeye. Remember, I'm an eye doctor, so it's kind of a play on words. Fortifeye.com. I see a lot of people chiming in on social media saying they're taking it and they love it. And also they want to know the phone number so they can call in. So let me give you the number, 1-877-969-8600. You can talk to Doc Hall or myself, Dr. Lange, right now. Consultation is free. That's 1-877-969-8600. All right, while we're waiting for the phones to ring, I want to mention something that we haven't talked a lot about in the last few months, and I'm shaking it right now. This is our Fortifeye Super Omega 3 Max. We have two Omega 3s, Fortifeye Super Omega and Fortifeye Super Omega 3 Max. Omega 3 Max is actually 50% more potent than Super Omega. Fortifeye Super Omega 3 Max is the most potent triglyceride form Omega 3 in the industry that I know of, and I follow this very closely. We've got an EPA of 1,200 and a DHA of 900 per serving. So nothing comes that high in a triglyceride molecule. Now, remember, all the fish oil that you buy over the counter, well, I shouldn't say all the fish oil, but the majority of the omega-3 that you buy over the counter is an ethyl ester molecule. That means it has ethanol attached to the backbone. Folks, that means it has to go through your liver every day, cleave the ethanol off, replace a triglyceride backbone before it absorbs. That's very inefficient. It's very unstable. Most of that fish oil is actually rancid before it even goes into your stomach. So that's why when you're looking for fish oil, make sure it says TG form on the fish oil or triglyceride form. You won't find one for the price that we're offering, Fortifeye Super Omega or Fortifeye Super Omega 3 Max. At our price right now, what is $28, $29 for Super Omega, and I think $35 or $36 for Super Omega Max. And that's for 60 gel caps. And remember, we're still running the Show 25 special because we're not having a Lange Eye Institute Fall Festival this year because of the COVID-19 virus. So take advantage of this. Go online, fortifeye.com. Go see Doc Hall at the Lange Nutrition Center in Ocala, or come to the new Fortifeye Nutrition Center in Clearwater, and we'll still honor the 25% off Show 25 for Super Omega 3 Max. There isn't a pure, more concentrated form of omega-3. If you took only one supplement, only one, I would recommend omega-3 because of all the health benefits. It improves circulation to every part of your body. It lowers inflammation in the body. It's amazing for the heart, the brain, the eyes, the joints, the skin, lipids, triglycerides, C-reactive protein, cholesterol. So anyway, think about that. Fortifeye Super Omega Max at fortifeye.com. We're getting loaded up now, so the phones are ringing. All I had to do is give the number. Let's start taking some calls, Doc. Let's go to Carmen in Clearwater.
Hi, good morning.
Good morning, Carmen.
I have dry eyes, and they constantly tear, and the one eye swells up, and I wanted to know what kind of vitamins I should take for that, other than just putting hot compresses on my eye. I have a real problem with it. It's gets worse, and I'm 68.
You're young.
And I do not have I do not have what is it, diabetic retinopathy?
Right.
So I get my eyes get checked thoroughly every 6 months, for things like that. I have had laser surgery on my eyes for other issues, but I haven't had anything major in a long time. But the dry eye is constant. Is there any cure for that?
Well, I wouldn't say there's a cure for dry eye, but there's definitely some effective treatments. And you're in the same boat with many women over 60 have dry eye, and many men have dry eye. So eyes that feel sandy, gritty, burn, tear, itch, fluctuation in vision. All of this is related to dry eye. And I always say there's 4 steps that you have to do. You got to heat the lids, clean the lids, nutrify the glands, and lubricate the eye. So clean the lids at nighttime right before you go to bed with some OcuSoft foam or even baby shampoo. Just clean them really good before you go to bed. A hot compress 2 to 3 times a day, either the Brooder mask that you put in the microwave for 20 seconds or just a hot washcloth or a tea bag, something to heat the glands up. That opens them so it helps secrete a healthy lipid layer of your tear film. Then using good lubricating eye drops. The lubricating eye drops you buy over the counter are kind of like the fish oil you buy over the counter. I don't love them, all right, because they don't do a whole lot. There's 2 lubricating eye drops that last. They last 3 times longer than the ones you buy over the counter, and that's either Fresh Coat or Oasis Tears Plus. You can buy both of those through your eye doctor. Sometimes you can find Fresh Coat at CVS or Walgreens. It used to be a prescription dry eye drop, but you can get all of this at the Fortifeye website if you go to fortifeye.com. And then the biggest piece of the puzzle, so if you're cleaning them, you're heating them, you're lubricating them, and you're drinking enough water, believe it or not, eat a banana or an avocado daily, or alternate. One banana one day, one avocado the other day. Those are high in potassium. Potassium deficiencies aggravate dry eyes. But the biggest piece of the puzzle that most doctors miss and most patients miss is proper nutrition for dry eye. And what I did after years and years of research, I developed something called Fortifeye Advanced Dry Eye Therapy Blue Light Shield. I'm holding it up on social media right now. It's a box, and in the box, there's 3 bottles. There's a bottle of our Super Omega. There's a bottle of our Fortifeye Focus. That's lutein, zeaxanthin, and astaxanthin. And there's a bottle of a supplement I developed called Black Currant Seed Oil GLA. And the studies indicate, and all those studies are on the website. So if you go to the website, Carmen, at fortifeye.com, and you go to Advanced Dry Eye Therapy, the supplement, you can see why I put these together. All the science is right underneath it. You click on it, and you can see all the science and the studies and the information, why it works. And then the real issue is if you try it and your symptoms get better, then you know it worked. Now, anytime you do a nutritional adjustment, it doesn't happen overnight. So I always say give it 3 months. And at 3 months, if you're not getting any benefits, then obviously, let me know. But, follow up with your optometrist, follow up with your ophthalmologist. But it's called Fortifeye Advanced Dry Eye Therapy. And you can always contact me directly on the Fortifeye website. There's a section, Ask the Doctor. It comes directly to me. And I've written a lot of articles on dry eye on the Fortifeye website, and it goes into this in detail. Okay?
Dr. Lange?
Okay.
All right. Thank you, Carmen.
Dr. Lange?
Yes, Doc Hall.
I just want to add just one real quick thing on our dry eye kit. That contains all 3 of the following omega-3s, our Focus, and our GLA Black Currant. And by buying it in the kit, of course, there's a certain synergy there that works together, and they're formulated to work together in synergy. But you also receive a super huge discount by buying all 3 in a group like that. It's just $63. And it can be found very easy on our website, or give us a call. We'd be glad to ship it out to you. But it's very convenient, and it's laid out, tells you exactly when and where to take it, the dosage, the whole thing. But it's at a super good price when you buy it in the 3-pack like that.
Right. And, also I take this, because of my competitive motocross accidents back in the day, broke my neck, my back, my right leg in like 5 places. I got some degenerative arthritis and some pain when I wake up in the morning. And I take this not for my dry eye, but for my pain. And believe it or not, it helps pain dramatically. When you look at all these natural pain relievers, what do they have in common? They all have omega-3 in it. And a lot of them have the GLA in it as well. And some new ones now have the astaxanthin. But I put that piece of the puzzle together a few years back. Well, astaxanthin helps dry eye, not only pain and inflammation. So it's good for all of you that have arthritis. It's good for those of you that have dry skin. So it not only helps dry eye, it helps dry skin as well. Also, it helps lipids. It can help your cholesterol, your triglycerides, your C-reactive protein. So it is a pretty good supplement, not only for dry eyes, for everything as well. All right, we're getting loaded up. Let's go to Arthur in Bradenton. Arthur, good morning. Thanks for holding.
Good morning, doctor. I had narrow angle glaucoma and had laser treatments to fix that, but now I have pressure in my left eye at 27 and right at 21 is the pressure in my right eye. But my optic nerve is okay, and the doctor told me he wants to wait a couple months before he starts any treatment. Is there any reason why that pressure has increased like that?
Well, it's probably just pressure can go up. There's a lot of things that can cause the pressure to go up. Your angles could be getting narrower, but if you had the laser procedure, probably that's not the case. If the laser truly went all the way through the iris, you could be just developing elevated pressure just related to more or less, now it would be open angle glaucoma. Certain drugs like steroids, prednisone, cortisone can make the pressure go up. Inhalers can make the pressure go up. age can make the pressure go up. Like I said, a cataract can make the pressure go up. So there's a lot of different things that can cause the pressure to go up. But what your doctor needs to do, and it sounds like he or she is on top of things, they need to analyze the optic nerve, make sure the optic nerve is healthy. They'll do something called an OCT analysis that looks at the insulation surrounding the optic nerve called the nerve fiber layer. And so if your nerve fiber layer is healthy and stable, your visual field is normal, and if you have thick corneas, if they do pachymetry and you have thick corneas, then sometimes you wouldn't treat a pressure of 26, okay? But by the same token, if you have nerve fiber layer that's thin, if you have thin corneas, all right, then they probably should treat this so it doesn't become glaucoma later on in life, all right? Remember, glaucoma is the sneak thief of your sight. You have no symptoms until it's too late, and you won't have symptoms until you start losing peripheral vision very quickly. That's why the doctor has to follow you very carefully. There's some things you can do naturally, Arthur, to help with glaucoma or help with elevated pressure. Cardiovascular exercise, getting on a treadmill, elliptical trainer, your bicycle, walking fast, getting your heart rate over 100 for 30 minutes 5 times a week, all right? That can bring the pressure down by as much as 25%. Omega-3, all right? So my Fortifeye Super Omega or Super Omega Max or any omega-3 that's the triglyceride molecule. It doesn't have to be Fortifeye. There's some good studies that have shown that it can help lower pressure. High dosages of vitamin C can help lower pressure. And right now, during these crazy times, both the omega-3 and the vitamin C can help with your immune system. So try, more cardiovascular exercise. Try the omega-3 and vitamin C. Obviously, follow your doctor's advice.
Okay, then. Thank you very much, doctor. I appreciate it.
All right. Take care, Arthur. Happy Halloween.
Same to you. Bye-bye.
All right, let's see. We're going to talk to Doc Hall in a minute about some more fun stuff, but we're going to go to Grace in Clearwater. Grace, good morning.
Good morning, doctor, and delighted to hear you're in Clearwater. The Fortifeye vitamins, will they be available there?
Absolutely. We've got a whole huge section for Fortifeye at the new Fortifeye Nutrition Center. So all of our products are there. We've also got Paleo Simplified. We've got Douglas Laboratories products, Life Extensions.
The focus.
Oh, absolutely. We've got, we actually literally have a pallet of Fortifeye Focus and 2 pallets of omega-3 because it sells so fast. Yes.
Okay. And I'm going to I've gotten and by that lady, you said First Coat. I got that from you. It's excellent.
Good.
That First Coat. And I have glaucoma, and I've had a trab, everything. And I got your blue light glasses years ago, if you remember, the blue blockers.
Right. Blue light defense, right?
So now I'm going to get a new pair, and I want to know, and you don't have them anymore, what are the best ones to get, the lens? What should I ask for?
Well, I like blue light defense and blue light shield. Those are my 2 favorites because they're clear, but they filter the blue light, and you can actually check with a laser. And anytime you buy a blue filtering lens at an optical, ask to do the laser test because a lot of the blue blocking lenses out there.
I'll say they don't have that.
Yeah, then you might want to.
Having a hard time.
You might want to go someplace else.
I don't know where to go.
Well, I mean, you can get. You can get lenses made at the Lange Eye Institute in the Villages. You can send them the prescription. Yeah. But all you gotta do is. I want to know the science. What is the lens? There's another good lens called True Blue. All right. So remember that one. So I'll give you a list: blue light defense, blue light shield, True Blue, or Blue Tech. Okay.
Blue Tech.
And those are competitors of all those are competitors of each other, but they're all good quality lenses. Any of those 4 are going to filter the amount of blue light that you want to filter. Blue light defense and blue light shield are clear. They're totally clear. True Blue and Blue Tech have a yellowish brownish hue to them. And the reason for that can maybe filter a little bit more of specific wavelengths than blue light defense. So blue light defense and blue light shield filters a little bit more of the shorter blue waves than the other 2. And the other 2 filter a little bit more of maybe things coming from the iPad or the computer, a little bit more. But they're all very good.
Okay, now, I was writing that other stuff down. The True Defense Shield, more of the, just repeat that one again there.
Yeah, the True Blue is good. It's really one of the best at filtering a little bit more from the computer, all right? But a lot of people don't like the yellow color, and that's where Blue Light Defense or Blue Light Shield comes in. And then Blue Tech is kind of in between all of them.
Okay, so either way. Okay, I think you've answered. That's good enough.
And always ask for a discount, okay? Because let me tell you, right now, during these crazy times, some eye care practices don't have a lot of people walking in. So, you can always say, well, look, can I get a discount, a good customer discount? Now, they might say 10%, take it, but they might say 20%. They might say 25. You never know if you don't ask.
And if worse comes to worse, I can get the prescription, and I can, how could I mail the prescription to y'all?
Well, yeah, you could just contact the Lange Institute in the Villages, Florida, and they could absolutely take that prescription, and they could fill it, and they can make it for you. Yep.
Okay, doke. All right, thank you.
All right.
I'm glad to have you around.
Take care, Grace.
Bye-bye.
Bye-bye. All right, you're listening to Ask the Doctors. Doc Hall and myself, Dr. Michael Lange. Give us a call at 1-877-969-8600. That's 1-877-969-8600. I tell you what, we get lots of questions, both Doc Hall and myself, on sports nutrition from that Nashville market especially, and a lot from Atlanta. I mean, maybe there's a lot of athletes, but we get a lot from Florida too. I got to say that. So there's a lot of athletes that listen to this program. And one of the reasons is the Fortifeye Performance line of nutrition that Doc Hall and I both worked on. We developed something called Fortifeye Fit, and we developed the Fortifeye Super Protein and the grass-fed whey isolate. Doc Hall, let's expand a little bit on, we've got that kind of that double whammy for building muscle, endurance, strength, and it's called the Performance the Performance Bundle, Performance Stacking Bundle is what it's called on the website. Let's expand a little bit on that, because you're like one of the leading authorities in this area.
Okay, before I go into that, Dr. Lange, I just want to add a little bit of information there on the blue light lenses. You fitted me with blue light lenses about 2.5 years ago. And you advised, because I'm on the computer all the time, I'm on a cell phone screen, I'm, what am I relaxing? I might be watching TV or like that. So I'm exposed to the blue light constantly. And you advised, to go with the blue light lenses. Neither you or I require a eye prescription, which is fantastic. So I've really never worn glasses before. And but when I put on these blue light shield lenses, glasses, that was fantastic. My eyes don't get there every day in the afternoon about 3 or 4 o'clock. My eyes would just fatigue out. I don't have that anymore, so that's a good thing. I want to just throw in one thing real quick here. I need our listeners' help here a little bit. There's only so much we can do in a 1 hour show. In fact, it's even compacted under an hour. And we could be on the air for the next 2 days straight and never, accomplish what you need for us to do, question and answer wise. And so I'm trying to talk Dr. Lange, and I've been beating him up over this over the last probably 6 months, that he and I need to put all this together in book form, and a very easy reading type of thing. So let us know if that would help you, and that will make my job easier too, of convincing Dr. Lange. He has a ton of stuff to do. I do too, but I really think this is real important for us to do. So let us know. And I'm not, going behind his back or anything. He knows how I feel about this. But if there's a need out there, we'll do it. If there's not, it's not an ego thing for us. It's an informational type thing. So
right.
Let us like it. But anyway, let me get real quick here.
And Doc, let me just chime in really quick. I want to say hello to a lot of our listeners on social media. We got a ton of people watching. Black Mountain, North Carolina, Charleston, South Carolina, Cincinnati, New Mexico. All of you guys and gals, just hello from Ask the Doctors here. And one more time, phone number, we have time for another few calls, 877-969-8600. That's 877-969-8600. Remember, Fortifeye Super Omega 3, Fortifeye Super Omega 3 Max. Also, remember the Fortifeye Complete Advanced Nutrition. You can learn more about those at fortifeye.com. Let me give you the number, 866-503-9746. That's Monday through Friday. They are closed on the weekend. One more time, Fortifeye Vitamins, 866-503-9746. And remember, Fortifeye Nutrition Center in Clearwater opens today. I'll be there about 10:30 for a couple of hours, just chit-chatting with all you guys and gals, so come on out. All right, Doc.
And I think next week, we haven't talked too much about it, but I think I'll be over there this next week for on the weekend after the show. And so I want everybody to come by and visit. You can ask questions, and both Dr. Lange and I will be there, I think, this next weekend for sure.
Right. We'll have a much bigger, because then we would have been open for 5 days. All of our point of sales literature will be in. It'll be looking much better. This is kind of a easy start today, just a soft opening today. But yes, Doc Hall and myself both will be there next Saturday from about 10:30 till 1:30 or longer, just depending on how many people come in. So we're looking forward to that.
As long as the people are there, we'll be there. We don't walk away. And let me just add real quick about the fit and the protein. The fit formula, Dr. Lange and I worked on that for almost 3 years. We worked 6 months just on the taste alone. It's a pre-workout, post-workout formula. I'm a recovery specialist in the sports nutrition field, and this is the best and only thing out there. It's fantastic. You couple that with our one of our proteins, and you are good to go. You don't have to open up 25 different this and that and everything to accomplish your goal. Buy our performance nutrition brand Fit and our protein, and you'll see a huge, big difference. 90% of athletes and people that are exercising and like that, 90% do not recover properly. This gets you into that zone.
Yep. And remember, we got a great deal. I call it the double whammy for building muscle, strength, and endurance. It's the performance stacking bundle at fortifeye.com. It gives you both the fit and your choice of protein. Remember, we do have the new dark chocolate fudge protein available now, the super protein, certainly the vanilla, our #1 seller. And we have the naked protein for all you purists out there that don't want anything at all in their protein other than protein. Fortifeye Super Protein, Naked Protein, New Zealand grass-fed, non-denatured protein. There isn't anything like it on the market. Look at the case pricing on the website. The case pricing is amazing, and I mean, it brings the price down dramatically. All right, we're getting loaded up. We're gonna have to go to some calls pretty quickly here. Let's first go to Leslie in Sarasota. Leslie, thanks for holding. Good morning.
Hi, good morning. I have a question. 3 weeks ago, I was diagnosed, my husband and I, both of us, with COVID, and my husband seems to be back to normal. He's diabetic. I have thyroid issues, but I just seem to be having trouble getting over the hump. I'm taking 50 milligrams of zinc, a B12, a D3 with a K2, and a CoQ10, and I was just wondering if there was something that you could recommend that maybe I should add to the supplements.
Yeah, absolutely. I would probably add a quercetin bromelade supplement. And I would cut the zinc back to 40 milligrams, okay? And make sure it's not zinc oxide. So zinc picolinate is a great one. Anything other than zinc oxide. So chelated zinc, zinc picolinate, zinc citrate, zinc monomethithione. But I'd cut it back to 40 because anything over 40, you need copper with it, all right? Otherwise, you start having copper deficiency. So if you go to 40, you're going to be fine. But if you add the quercetin and bromelade, that's going to make the zinc absorb. It acts as an ionophore. It makes it absorb much more readily. So you can get away with 40 milligrams, and it'll absorb a lot better than the 50 milligrams. And sometimes it's hard to find, but we'll have it at our Clearwater Nutrition Center. You can get it online at fortifeye.com. I purposely put it on there from Douglas Laboratories. You can look at it's quercetin and bromelade. Make sure you're taking vitamin D3. I think you said you were taking vitamin D3.
I am.
The other,
someone also recommended that I take that with the K2. It helps to absorb the D3 better. Is that true?
Well, the K3 especially helps it absorb into the bone. Any K1, K2, K3, all of those. Or eating some organic spinach or kale, cooked kale or spinach with it has the natural form of vitamin K in it, and that can be beneficial. Also, a little vitamin C isn't a bad idea, but omega-3.
I was drinking orange juice, and yesterday I started drinking coconut water just to help with my electrolytes.
Right.
So
Coconut water is a great source. Add a good triglyceride form omega-3 to the mix because that helps with this cytokine storm, the inflammatory reaction that is out there right now. With that, we don't have time for any more of talking, okay?
Okay.
Thanks for the call.
All right, thank you.
Have a great
All
day.
right, bye-bye.
And I apologize, everybody else on hold. We didn't get to you. We'll get to you next week. Doc Hall, we got 13 seconds, so time for you to say goodbye.
Happy Halloween to everybody. Please be safe out there. And remember, wear your mask. We'll see you next week.
Yep, we're out here. Have a great day. God bless you, and God bless America. That's a wrap.